Hey guys, welcome back to the channel where we'll be checking out a video titled How Medicare-For-All Works in Australia. What's wild is that Medicare is literally what it's called in the United States. So kind of wild to think about it. But yeah, we're going to be checking out this video right now. So please do like and subscribe as usual. And any recommendations, feel free to leave those in the comment section down below. Or preferably click that link in the pinned comment section. Now check out that video as soon as possible. Without further ado, let's learn a little bit about how Medicare in Australia works.
The 2020 Democratic primaries are in full swing as the candidates argue over the best way to approach policy. One of the biggest policy divides, the role of private health insurance.
We have got to pass a Medicare-For-All single-payer system.
Private insurance is not working for tens of millions of Americans.
The quickest, fastest way to do it is build on Obamacare.
Many countries around the world provide government-funded universal health care while offering secondary private insurance. One country that's frequently overlooked? Australia. So how well does Australia's system work compared to U.S. healthcare? In 2017, Australia is estimated to have spent 9.2% of its GDP on healthcare, while
Damn, that's not even a lot. That's under 10%. That's not even a lot. America has 17%? Oh my gosh, that's so much more. Wow.
the U.S. spent nearly twice that at 17.1%. In other words, Australia spends about $5,000 USD per person, while the U.S. spends over $10,000. Despite spending about half the money, Australia has better or comparable health outcomes to the U.S. The average life expectancy in Australia is 4 years higher.
Damn, that's crazy.
In the U.S., and Australia's infant mortality rate is lower. Additionally, the maternal mortality rate in America is nearly 5 times higher than in Australia. Australia's healthcare system is sustained by a publicly funded universal health insurance network called Medicare. Australians can also purchase private health insurance to cover hospital treatments or services that Medicare doesn't cover, such as dental or vision. But private insurance in Australia isn't meant to replace Medicare.
I think it's a bit of a given that if you make above a certain amount, you just have to kind of hold your nose and buy in.
That's Dr. Elizabeth Bates. She's an American who now lives and works in Tasmania, Australia. She did her medical...
Tasmania. I remember checking out a video about Tasmania. It was really entertaining. You guys can search on the channel. You see that video about Tasmania, but it was pretty cool.
Training in both countries. For full disclosure, Dr. Bates' husband worked with the Australian government to help digitize citizens' health records.
I hear more from people that are going through the public system a bit of, well, even if I'm not a private patient, ... So there's always that fear, I think, that people won't be treated as well, which I don't think really plays out.
Most Australians with private insurance receive a government rebate to help cover their monthly premiums. Also, if Australians purchase hospital coverage before age 31, they avoid an extra charge on private insurance premiums for the rest of their lives. Under Australian Medicare, doctors can set their own prices. However, many follow the Australian Medical Association's list of suggested fees. If a doctor charges more than the Medicare standard fee, the patient is responsible for the difference. These out-of-pocket costs are known as a medical gap, similar to a copay in the U.S. So how does this healthcare scheme stack up against the U.S. when it comes to the chronically ill patients who use the system the most? Crescenda Keith, an American citizen, and Kirsty Wilkinson in Australia both live with a rare condition called Ehlers-Danlos syndrome, which is also known by its initials EDS. The symptoms can vary in severity depending on the individual, making it difficult to characterize.
It's a continuum. Some people have it to where it doesn't affect their day-to-day life, and some people I know are completely bedridden.
Crescenda has changed insurance statuses several times over the years, going from private insurance that offered comprehensive coverage to no insurance to the government-funded system for low-income Americans called Medicaid.
Going through with the private insurance, it was incredibly easy to get something as simple as a geneticist to diagnose me as opposed to a primary care doctor and a rheumatologist, which was amazing. And it actually, because I had racked up so many bills trying to figure out what was going on, that the geneticist, I had no copay, no nothing.
But Crescenda ended up going from having private insurance to having none at all.
To go from that to having nothing is shocking. I did better waiting until I was so sick that they had to admit me to the hospital and seeing the specialists in there and just racking up those bills, which the the hospital ends up writing off anyway.
After a few years of being uninsured,
Damn, that's tragic because like there was this one friend that I had and she had a similar issue, but hers was cancer, and she was young, obviously, and it just kept happening and happening and happening, and she's in a lot of debt because of her medical issues in the United States. So this is real life. A lot of people do have these situations, and it's quite unfortunate.
Crescenda was able to get on Medicaid after a long process with a lot of bureaucratic hiccups.
Finally, recently I was approved for Medicaid, which I thought was going to be the best thing ever. That opens the door to a primary care and opens the door to specialists. The specialists are not even in the area. You give me an hour drive to get to a doctor, that's absolutely inaccessible. And at this point, you're kind of like, well, I wish I just had no insurance, because that little aspect of hope is sometimes worse than accepting the fact that you have no hope. We're looking into filing bankruptcy because a lot of the medical bills, even though I was low income, for some reason, they still went to collection, even though I contacted people. Even some of the medical bills from when I had good insurance, where I was supposed to have no copay, are now in collections because I didn't know about them and I was moving.
By comparison, Kirsty's insurance coverage has been more consistent over her lifetime. She chose to buy private insurance to help cover her expenses. She thinks that investing in private insurance in Australia is worth the extra cost for convenience and peace of mind.
For me, while I'm in private, is you get choice of doctors. Choose when you have treatment, which is a big plus, because in the public system, you can be waiting months. If I didn't have private cover, I think I'd be up for a lot more. Because what some people say is that you should just put the money aside, but the thing is, you don't know what's around the corner.
I'm a huge fan of universal healthcare coverage, but nothing in this world is perfect. If somebody's got an acute problem here, they can get in very quickly, but if it's just sort of a just-in-case safety check, there's a very long wait through the public system, and that makes me nervous.
It's kind of crazy how one person is speaking about the wait system while the other person is emphasizing on the debt that they're, facing because of the situation that they're in, and how there's no hope.
Because we know the reason we do universal screening is somebody out there's going to have a cancer sitting there quietly, and I would really like them to find that out before it causes a problem and spreads.
Kirsty finds that while her costs may vary depending on her physician and treatment, some of her doctors take into consideration that she's a long-term patient on government disability.
Because I'm on the disability support pension, and the hospital I go to, generally, they actually bulk bill, and the clinic I go to, for my MRIs on my knee, for example, they actually bulk bill because I'm referred by a specialist. It really depends on, I think, your doctors in terms of how much they charge you. I mean, there are doctors out there who charge a lot more than
effectiveness of their healthcare systems. Around 45% of people in both countries are concerned that their medical costs will increase over the next decade. There are some differences, though. While both Australians and Americans rank the cost of accessing treatment among the top 3 problems facing their country's healthcare system, only 38% of Australians felt that way, as opposed to 64% of Americans. Australians were evenly split on the biggest issue between cost, staff shortages, wait times, and an aging population. A big difference between the countries is that only 4% of Australians feel that their country's healthcare system needs to be completely rebuilt, while about 23% of Americans feel that way. Crescenda and
Only reason why 23% of Americans feel that way is because it's likely that those 23% has had family or friends where they see them suffering because of the healthcare situation. Because I do believe that it's quite easy for the United States to actually
and Kirsty's
have a more
experiences show that
sustainable
both
healthcare
the
system
American
for
and Australian systems
but,
have their problems. But the Australian system does offer more consistency thanks to basic universal coverage.
I think, we're really lucky to have the system we have in Australia. I think Medicare does make it, even though you might only get half back or whatever when you're seeing doctors, at least you get something back.
Exactly. Like, I think the Medicare in Australia is way better than the ones in United States. And the thing is, you're not going to really understand how much better it is in Australia unless you are actually an American or someone who is actually experiencing both. And based on the two persons who gave their opinions, you can clearly see that one person is struggling financially to meet these things, while the other person said, well, they're going to go with the base rate so that I don't have to pay anything out of my pocket. Like, it's obvious which one is better for the civilian or for the citizen of that country. So you guys can let me know what y'all think in the comment section down below. But I think the Australian healthcare system is better than the American healthcare system, as shown in this video. But thank you guys for watching. I'm out of here. Peace.